Yeah, the rate of flu cases here is already alarming.
Doctors' offices and hospital emergency rooms are full of patients with the flu. Fox Connecticut's John Chortland here now with a look at just how bad it is this year. John, pretty bad.
Yeah, that's right, Allison and Brent. The Connecticut Department of Public Health just released a statement saying that flu activity in the state continues to be widespread, and state health officials advise people to take steps to prevent the flu. That includes avoiding packed places, even those which are supposed to maintain a healthy body. At the gym, reps work out easier if no one's breathing down your neck to use your machine. And personal space, even with a personal trainer, is a good idea right now.
Good.
A healthy body, I assume I'm going to be able to fight the flu a little better if I'm in good shape.
This flu season, it's shaping up to be a very sick one.
Lots of flu-like symptoms and vaccines wanted and things like that.
At New England Urgent Care in West Hartford, about 30 to 40% of patients are coming in with shivers, coughs, and a temperature.
It's what's called a pandemic right now.
Dr. Michael Gutman acknowledges the flu is widespread, but nothing to panic about. And neither is the supply, he says, of Tamiflu, which is reportedly running out in some areas.
They're handing out like candy right now.
Dr. Gutman has contacted his distributor for more Tamiflu and Relenza, which effectively treat the flu and help prevent it.
If you're trying to prevent it, you take it one pill once a day for 10 days. Same with the Relenza. It's twice a day dosing if you got sick, once a day dosing for 10 days if you're not.
Of course, good prevention is frequent disinfecting. At XL Fitness in West Hartford, routine is key.
We also have a cleaning crew that comes in here once a week and sanitizes everything.
Well, the sign says it's a requirement for all members and guests to wipe down the equipment after they use it. But another good idea is to also wipe down the equipment before using it.
Because I don't know if the person before me did. I came in, I don't know who used this, whether it was last night or this morning. So I just wipe it down. It's just a good practice for me.
And to talk to us a little bit more about the flu and how much of a problem it is Hartford Hospital's Dr. A.J. Smalley. Tell us a little bit about what's going on over there.
Well, a lot of flu is going on. We've had 30 or 40 people every day come in with flu-like symptoms, at least, fevers, coughs, etc. And unfortunately, the flu really doesn't have a lot of treatment beyond 48 hours. A lot of them don't really need to be there, but they're not sure what's the matter, and our job is to tell them it's okay to use symptomatic measures, which is mostly what we treat the flu with, Tylenol, Motrin, etc.
Now, as far as the vaccine goes, a lot of people have been getting the vaccine already weeks ago, but you can still get the vaccine now, right?
Yes, we're at probably near the peak of our flu epidemic for this year. It's the highest I've seen in a number of years as far as the number of people. And the chance of you getting it is still going to be present for the next several weeks. So, yes, I think everybody who, if you haven't had the vaccine, you should get it today or tomorrow.
How about Tamiflu? How's that looking as far as supplies at the hospital?
We've not had any trouble with supplies. The problem with that drug is that for people who don't have a lot of serious medical problems, it only is useful in the first 48 hours. And most people don't really realize they have the flu for beyond that.
Now, as far as this pandemic, is this something you guys expected since we had a couple years there where it wasn't so bad, the flu, and now all of a sudden we're getting hit hard?
No, I can't say we really expected it. I think we were ready for it, but the last couple of years have seemed pretty nice.
All right, and obviously some of the things to do to prevent the flu, kind of give us a few ideas here.
Well, if you can avoid crowded places where people are coughing and sneezing, that's great. If you are in places like that, good hand washing techniques, you know, if someone is coughing, turn your head, walk away, whatever. I mean, it's very hard to avoid. It's better to get the flu shot.
All right, thank you, doctor. Let's send it back to you guys, Allison and Brent.